Hi everybody, it's Dr. Sherry Caplan doing another segment on Ask the Doctor. This week, one of my patients had come in and it was a case that I thought, oh, this would be great to do a talk session on. So she's a patient of mine who is in her 40s, and over the last few years she's noticed that her memory isn't what it was, and that's starting to scare her. And I can imagine that is something that is very concerning. All of us really want to have our mental faculties at its max, because what's the point of living into your 80s or hundreds or whatever age you want to live till if we don't have good cognition. So basically, we sort of looked at what are things that she's doing that may hinder her memory, and what are things that she can do to help improve or delay cognitive decline. So we do know that there's a lot of lifestyle things that we do that can make things better or worse. So basically, we kind of looked at, what is her hormones doing, because we do know that as your hormones decline, hormones are involved in repair and regeneration, and it's not uncommon for women to start complaining of memory loss around perimenopause and menopause. I've talked in the past how each hormone has an effect on the brain. So estrogen kind of helps the neurotransmitter serotonin, which is our happy hormone or neurotransmitter. Acetylcholine is for concentration. GABA, and that's a whole nother talk that, one day I'll go into what each hormone does in the brain and how it helps, but essentially making sure your hormones are optimal, and if they're not, consider replacing them or look at how we can sort of balance things a little bit better. Looking at stress levels and cortisol levels. So we do know that high cortisol causes memory impairment. There's studies even showing that women who multitask are at higher risk of cognitive decline or memory issues because of that. And tell me what woman doesn't multitask. When your cortisol is really high, it also inhibits all your other hormones, so they can actually be low and suboptimal, which also can affect our cognition. And so one is, we talked a little bit about that. The other thing is making sure you're getting enough sleep. Sleep is really important, because that's another time where, we actually clean up the junk in our brain, where we sort of detoxify and repair. So it's important to get sleep. Diet is really important. So we know that eating a lot of sugars, having high elevated sugars, can lead to cognitive decline. We're now talking about how Alzheimer's and dementia may be basically type 3 diabetes. So that's kind of a relatively new concept. So making sure you're keeping your sugars in the normal range is really important. We know that sometimes doing intermittent fasting or time-restricted fasting, which I talked a little bit in my other videos, does help reduce inflammation and also can help with cognition. A couple of weeks ago, I shared a Facebook post on a TED Talk on how we can actually increase neurogenesis, which is the ability to make new neurons, which is really important because it affects memory, but it also actually affects our mood. And again, what it was talking about is all these things that I'm talking about right now. So it was about stress reduction, getting your sleep, eating healthy, taking certain supplements, making sure you don't have certain deficiencies, and I'll talk a little bit about that. But essentially it shows that we can actually make new neurons. So it's not like, oh my God, we have what we have and it's all a downward trend, but that we can actually modify things and actually improve that, as opposed to just waiting for them all to die. So basically intermittent fattening and time-restricted fasting was on that. Exercise is huge in preventing cognitive decline, or increasing neurogenesis. So basically when you exercise, you generate BDNF, bone-derived neurotrophic factor, which is a growth hormone for neurons. So that helps. Meditating, I think, is something that has shown to, I think, mostly help lower cortisol and actually make new neurons in the frontal cortex. So I think that's great. Certain micronutrients are really helpful. So getting flavonoids, which, come from blueberries and, red wine, but we'll talk about that in a second. But, fruits that are on the blue and red range help. We actually have some studies on curcumin in terms of improving brain health, but also increasing neurogenesis. Actually, caffeine can help with memory. So depending on if you're a slow or fast caffeine metabolizer, how many cups of coffee are safe, because if you happen to be a slow caffeine metabolizer and you're having 3-4 cups of coffee a day, actually can increase your cardiovascular risk, which in the end will actually impair cognition or cognitive function. Whereas if you're a fast caffeine metabolizer, having that 3 or 4 cups of coffee actually lowers your cardiovascular risk, but actually caffeine increases brain function or executive function. Alcohol, it ends up showing that alcohol can actually impair neurogenesis, the ability to create new neurons, or actually is toxic and can kill the neurons that we have, so not so great. Some studies have also shown that if you're deficient in B vitamins, vitamin E and vitamin A, that also sort of reduces our ability to create new neurons. So kind of making sure that you're getting sufficient amounts of those nutrients. Again, I've talked about in the past how we do at VitalityMD do genetic testing, and we can see if you're genetically prone to be low on vitamin B, E, A, D, a whole bunch of other ones, as well as looking at what kind of diet you would benefit, and are you someone who would do better on a high-fat diet versus a low-fat, and looking how you manage your carbs. So all interesting stuff, but going back to brain function. So, for her, we really wanted to sort of modify all those things. And interesting, as we age, our ability to take our short-term memory and store it into long-term memory is a little bit impaired, so that when we meet new people, if we kind of really haven't focused on that person's name, we're a little less likely to remember that, or a password that we're not using regularly may not get stored, and that's why sometimes we have a hard time remembering passwords. So there's certain brain exercises that you can play on computers or apps that you can do to sort of exercise your brain. I think like anything, a brain is a muscle and we need to exercise it. But there is a website that you can go to, and I'm just going to read it off. It's cognicity.com, so COGNICITI.com. For anybody over the age of 40, could do this memory test. It's about 20 minutes, and it sort of gives you an assessment of how your brain's doing. So I think that's kind of neat. And then if you're sort of doing all these things and you're still concerned, then being referred to a memory clinic is always helpful. Just realize everything takes time. It takes time to kill neurons, and it takes time to regenerate them. So if you're not doing all the things that you should be doing, incorporating them is a great start, and realize that it takes weeks, months, and potentially years to see the change, but that there are clinicians out there who are doing the studies on lifestyle and showing that it does make a difference. Next week, I'm actually going to do a video actually talking specifically about diet and brain function, so stay tuned.